Postnatal depression is a depression that affects mothers in the first 6 weeks after having given birth. That is the technical definition of a postnatal depression. The core symptom of postnatal depression is a fixed low mood lasting for at least 2 weeks. And they're very important aspects of it. If you don't have those features, then it really probably would be fitting into a different kind of mental health disorder. Associated with that, you can also have not feeling any pleasure in life. So those small moments of joy that everyone experiences every day, you might not experience at all. And the other type thing is feeling very tired. So not being able to sleep and feeling exhausted all through the day. One of the other features is to think of the quality of the thoughts. So everyone has those thoughts, and maybe I'm not a good mum, or maybe I'm not doing this right. That's normal for anything you're doing new. With a true depressive illness, those thoughts become what we call generalized, which means I not only think I'm bad at doing this specific thing, I might have the feelings that I'm a bad person, or that I can't do any aspect of my life right, or I have like these feelings of guilt that you might not even be able to put your finger on why, but it becomes what we call generalized or systematized, so affecting all areas of your life. So one of the big physical signs would be weight loss, weight gain, again lack of sleep, and then the things that affect your, I suppose, mental capacity in terms of your memory, concentration, and that sort of thing. The really core feature of it is it's lasting for about 2 weeks, because estrogen has a strong interplay with things like memory and concentration. So you can imagine that really is kind of difficult to unpick sometimes, but I think the settled nature of it is one of the key indicators. Linked with that, you have a considerable loss of function. So you might not be washing properly, you might not be looking after yourself, and then we kind of go into the areas that are quite different from the normal aspects to something that is an illness that you need help to get out of. So baby blues happen in over 90% of ladies that give birth. So you can imagine that I would consider that normal. So more normal to have baby blues than not. And it is mood swings and an emotional disruption essentially for about 2 weeks, less than 2 weeks. And it generally again happens in the first 4 to 6 weeks of giving birth, generally sooner. Typically we see the picture of day 3 to day 5 as the onset after giving birth. Which can really kind of sucker punch women, because they feel that they're going to go home, they feel like they're going to be euphoric, they've got their new baby they were waiting 9 months for, and suddenly they feel very low. And then there's, what's wrong with me? Why am I not enjoying my life? Maybe I've made a huge mistake. And actually it's not anything of the case. It's more to do with the physical fluctuations of hormones, particularly estrogen, which is making them feel absolutely miserable. Yeah, so when we're thinking of that 6-week span, we're really kind of alluding to mostly a physical cause of the depression. So that is very much the effects, after effects of giving birth, and we know it's correlated to things like a long labour with extensive pain, and actually your relationship with your midwife, and I think that's to do with how safe you feel in the moment. Protracted labours are much more likely to have a postnatal depression associated, and having someone supportive in the room. So these are all things that midwives are trying to help with during the labour process now. Then there's the physical aspects of the process. You've been pregnant, your placenta has been causing a lot of hormones to be secreted, and suddenly that is now gone. So there is essentially a hormone crash that happens before you become regular in your cycles and things again. You're also lactating, and that has a significant impact on your mental health, with prolactin being a very key hormone that affects mood. So we know that you can also experience, when you stop lactating, for example, another dip at that time. So there's a very physical aspect to it. There's also the psychological aspects, where you are a new mum, and the whole thing of a whole psychological challenge of what that entails, which is becoming a life support machine for another creature who may or may not have difficulties, and you may or may not gel. And the other thing is bonding. So mothers very much blame themselves if they cannot bond with their baby. I think women expect to become some sort of green goddess, and then they're going to see their baby and there's light bulb moments going to happen, and that doesn't happen to everybody, and that's normal. Right? Sometimes you have to learn to love your baby, and that is completely normal. Absolutely, let the health professional know, but that doesn't mean that you are a bad mum at all. And I think when that doesn't happen for some women, they can start to blame themselves and have a lot of psychological burden based on that. The other thing is there might be a lot of other pressures for like maternity leave, being a single mum, family pressures. And it's great, families often rally around when a baby is born, but if you have a difficult relationship with your family, that can be a real crucible moment. Dads also can have a depressive episode in the postnatal period, and a lot of that, obviously they're not having the same physical effects that a woman is going through, but there is the same psychological aspects in terms of a role of a new father, maybe supporting his wife who might have mental health difficulties, and the change in the relationship between man and woman. So there are a lot of challenges. One of the difficulties specific for the men is they might not have such ready help available because the women are tied into midwifery support and perinatal mental health teams, while the men don't necessarily have that support. So just something that I like to keep in mind as a clinician, that maybe the partners are also struggling. Also, if you can help the partner, obviously helping the mother. So they all feed into each other. Yeah, so the big one is to get help, let somebody know. So I think a lot of women feel quite ashamed that they're not able to take that role effortlessly. And I don't know why we feel that women should be able to do that. I think there's a thought that we genetically are just able to be natural mums. And actually you have to learn to be a mother, and there's absolutely no shame. So do seek help as soon as you think there is a problem. We often find that if we can preserve a lady's sleep, it makes a significant impact to the course of the illness. Or a lot of the time someone will be exhibiting quite serious signs of postnatal depression. We're able to give them a period of protected sleep and those symptoms essentially resolve. So telling partners, family, asking people whether they can help with the nighttime feeds, for example, that can be considered beneficial. And the other thing is to be present. I think there's a lot of attention on baby, quite rightly. But mums can sometimes be lost. They're kind of seen as a vessel for the baby. And that's not really how it is. And there's a lot of attention put on the mums and on the babies and less on the mums. For example, coming round to give mum a hand is great. That sounds like an excellent thing to do. That might look like giving mum a break by doing the washing up or cleaning the house or helping do the laundry and that sort of thing. It might not look like the fun bit of looking after baby when she's napping. So there is a kind of mind shift on that. I think all the relatives want to have some time with baby, and that's the normal part of the family bonding process. But don't forget mum. Yeah. And also, I think there's an expectation that mums will be able to take to this like a duck to water, and families not providing that judgment and actually saying that's normal, that's okay, is very beneficial. And sometimes sharing of experiences. So you find generations going back might be able to share their own experiences. Postnatal depression often runs in family. So that might bring up for your mum what her experience was like, which might have been very similar to yours. There is great treatments available. And the one thing that is excellent is the perinatal mental health teams. They are wonderful and they can give a very good quality high level of support. So please do reach out through your midwife or through your GP. The mainstay of treatments are medication and psychology. The gold standard is really both. I think there's a lot of concerns about taking medication when you're breastfeeding. And essentially, what I want to make very clear is the risks of having a depression on your baby are much higher than any theoretical risks of medication. Medication has been shown to be very, very safe. And there's quite a considerable amount of studies into this at this point. So please do talk to your doctor. Please don't be frightened of medication. It needs to be used judiciously. I certainly don't recommend they're given to everybody. But for the right cases, they can really make a difference. Psychology is best done with somebody that has experience in perinatal conditions. And that's because they're able to keep baby in mind at the same time. And really kind of it's three of you going to therapy rather than just maybe the two. The other thing is just thinking about breastfeeding. There is a lot of pressure nowadays to breastfeed your baby, and there's a lot of benefits from breast milk. So what I would say, what is best for baby is what is best for mum. And if for your mental health reasons you cannot breastfeed your baby, you've been trying and it's not working for you and you feel a bit of a failure and it's time to stop trying, or you don't want to try and you feel that's too much, these are completely acceptable reasons not to breastfeed. And especially with the aspect of preserving sleep, your baby will benefit the most from having a happy, healthy mum, rather than there are significant benefits from breast milk, but really the priority is mum's mental illness and happiness.